Okay, physician-owned clinics, hospital-owned clinics. Now, this used to be against the law. I don't know if it is now. It might still be, but just one of those things that nobody enforces. So when I got out of school, POPs were starting to pop up, and it was illegal. But the wording was so gray, and the APTA and our people that were supposed to be protecting and working for physical therapy didn't have the lobby that the American Medical Association has. Shocker. So the American Medical Association just ran it over and said, oh yeah, physicians can have their own PT clinics, even though it's against the law. And it's proliferated since then. I think if you took a snapshot of wherever you live right now in the year 2000 and saw how many POPs clinics were there versus PT-owned clinics and compare that to now, it's not even remotely close. And you are never going to compete with a group of physicians who have their own physical therapists. And if they do what they do here, they basically tell their patients, you are not allowed to see anybody but our physical therapist, even though they suck, even though you're not going to get results, even though you're going to have to wait 3 weeks to get your first post-op visit. And I want you to start PT post-op day 4, but you're not going to be able to get in for 3 weeks. But don't worry, you still have to go to our PT, okay? If there's anything dirtier than POP's own clinics, I don't know what it is, okay? So those are absolutely destroying anything that's going on. And all of you that work for those people, because you get more paid time off and you get your bonuses and you get full medical coverage while you're screwing over your patients, you are part of the problem. I know it sucks to go somewhere else and take a pay cut, but you might have to do that in order to benefit your patients and your profession, or you can keep on looking out for number one. Or you can go open your own clinic and do your own thing. And we're going to go over that this Sunday on the Facebook Live, how to do that and be successful. So you don't have to screw patients over and you don't have to take a pay cut, but you might have to do something else in between in order to get to the point where you can run a successful cash pay clinic. All right, and now let's get to our last of the 4 options, the 8-minute rule. The 8-minute rule has, it blows my mind how many clinicians buy into this. If you are more concerned about how you're charging your patients as to the 8-minute rule, you work for an insurance company. You don't work for your patients. You work for an insurance company because your primary concern is how am I going to bill this? So when I got out of school and I got my first job at a PT-owned clinic, and we would have sales reps come from wherever to sell us the latest goofball gimmick, lasers, traction tables, whatever. The only question that the owners asked was what? What do you think? It wasn't, does this work? It wasn't, how does this work? It wasn't, does this get to the root cause? It wasn't, what are the results that patients get with this? It was the same question over and over and over. What's the reimbursement? So if your primary concern while you're treating patients is how am I going to bill this? You're not thinking about anything that's related to patient results, outcomes, your clinical competency. You're worried about how you're going to work for the insurance company. So the 8-minute rule basically teaches us or tells us that the longer we spend with a patient, the better the treatment. So if I saw a patient and I got down to the root cause and I completely fixed everything that's wrong with them in 20 minutes and it got them to function normally at a neuromuscular level and spent 20 minutes one-on-one, hands-on with them, that would not be worth as much as if I did 8 minutes of ultrasound and put them on a stationary bike for 10 minutes and then stretch their hamstrings for 10 minutes and then put them on a hot pack with stem for 8 minutes and then gave them a rub down on the shoulders for another 8 minutes. That second scenario, even though it's complete fuckery that doesn't get to the root cause, that doesn't help your patient, that makes you look like an idiot, that makes your patient understand that physical therapy doesn't work and that's why they go to the chiropractor after 2 visits wasted at physical therapy, that is much more of a legit treatment strategy, treatment format, because you spent more time with them than you did when you actually got to the root cause and gave them results. So the 8-minute rule has has mind fucked us into believing that it's the time that's the important thing, not the thought process, not the treatment strategy, not the results. So if you are working in a clinic and your primary concern is, how do I bill this? What am I billing for this? Did I see this patient long enough to bill the right amount? And if not, then I need to make up some kind of fuckery to waste another 5 minutes of their time so I can check the box on the billing code and get the 8-minute rule to work for me. The 8-minute rule is the worst thing that has happened to physical therapy since its inception. I don't know when it was, but had it never happened, a lot of this other stuff wouldn't have happened, because what the 8-minute rule tells us is that it's our job to track time for the insurance company. It's not our job to be a doctoral level educated clinician who gets the root cause, understands how to use physiology to our advantage, and most of all, get our patients back to normal function. That stuff doesn't matter. What matters is, how much time do we spend with them? And then you're still so mind fucked that you're still thinking of this when you go off and you open your own clinic. And what's the first thing that the conventional cash pay PT clinic owner says? Well, if you come to my clinic, I'm going to spend an hour with you. Who cares? If you're doing an hour of fuckery, I would rather spend 5 minutes with you and leave than be stuck there for an hour, paying for an hour, losing an hour of my time just to, in most cases, be made worse.